Rep. Kennedy, if you would like to take the stand, please give us your bill number, and if you would go ahead and introduce that bill. What I'm going to do is have all the representatives who had sponsored bills that pertain to the nature of this subject introduce their bills first, and then we will hear testimony on all of those bills concurrently.
Perfect. Again, my bill is House Bill number 5196, and if you recall from 2 weeks ago, mine provides coverage for insulin drugs used to treat diabetes and provides a copay not to exceed $50 for a 30-day supply, regardless of the amount or type of the insulin needed to fill the prescription, and the coverage would not be subject to any deductible. This last section is important since quite often patients have to pay the list price for insulin until they meet their out-of-pocket deductible. So this is an expense that many people cannot afford to endure, particularly now in these pandemic times. Did you want me to continue, or did you want to take up the next one? Okay. So just as a refresher, as I pointed out 2 weeks ago, insulin was discovered 100 years ago. It's regarded as one of the most important medical discoveries of the 20th century, and the patent for insulin was sold for a mere $1 because it was believed that insulin should belong to the world to save the lives of those with diabetes. Today, thousands of Rhode Islanders are living with diabetes, and people with diabetes typically pay anywhere from 2 to 3 times the healthcare costs of those without diabetes. The price of insulin has gone up dramatically. It went from $25 in the early 1990s to over $300, some cases $400, depending on the manufacturer of that insulin product. A family dealing with type 1 diabetes has seen insulin costs more than triple in recent years, and thus the need for this legislation. 15 states have passed insulin copay cap legislation. I have asked Stephen Habe to provide to the chairman, which he did do, and I believe it was posted to the committee website, the list of states and exactly what each copay or deductible is for those particular states. I did mention also when I was here last time that back last year, the Trump administration had announced a Medicare insulin copay cap beginning in 2021, and if you recall, Representative Morgan had questioned that. So I did a little bit of research on that, and for all intents and purposes, the Biden administration froze for a 60-day period of time any new rules that had not already been implemented at the federal level. Does not mean that it was rescinded in any way, shape, or form. It was frozen just for the 60-day period so that they have a chance to review those within the Biden administration, and then they can move forward from there. I'm not going to hold the committee up with hearing any more testimony. I think many of the committee members have already expressed a great deal of support for the legislation, and we did try to answer your questions last time. So what I'm going to do is turn it over to Representative Morales to let you know that Representative Morales and I have been talking about this, as has Representative Diaz, and our ultimate goal will be to merge this into a single bill. At the same time, we're listening to the input that has been provided by those who have expressed some desire to see some changes to the bill, and so we're examining them. Anything that I've received so far, I have forwarded to Stephen Habe from the American Diabetes Association so that he has a chance to review it with their legal counsel as well, because ultimately we want a bill that will work for the state of Rhode Island, work for those people in Rhode Island that are dealing with diabetes, and that the American Diabetes Association can be proud of. So thank you, Mr. Chair, and ladies and gentlemen of the committee.
Thank you, Representative Kennedy. Are there any questions from the committee for Representative Kennedy before he leaves the stand? Thank you, Representative. Thank you. Okay, I will now have Representative David Morales come and introduce his bill as well. His bill is House Bill 5151, I believe.
That's correct, Chairman.
Thank you.
Now, Mr. Chairman and members of the committee, thank you again for this second opportunity to discuss and consider House Bill 5151. In summary, this bill would limit out-of-pocket expenses for a 30-day supply of insulin at $25 for people with health insurance. Now, to briefly reiterate from our last hearing, across our state, over 80,000 adults have diabetes, which is more than 10% of adults in Rhode Island. Sadly, the rate of residents diagnosed with this disease continues to increase each and every single year. Between 2011 and 2019, the rate of Rhode Island adults with diabetes increased by 24%, nearly a quarter. Furthermore, the Rhode Island Department of Health has estimated that an additional 24,000 adults unknowingly have diabetes but have yet to be diagnosed. So it is clear, diabetes is a serious public health issue in our state, which is why it is necessary that our government ensures prescription insulin is affordable for everyone who depends on it. Now, unfortunately, the current out-of-pocket expense for insulin are extremely expensive, especially for working people and our middle-class families. In 2012, the average cost of insulin was $236 a month, or equivalent to $2,864 a year. In 2016, it rose to $475 a month, or $5,705 a year. As a result, we have thousands of people in our state who are forced to ration their insulin because they simply cannot afford their daily doses, despite the fact that it only costs us $3 to produce one vial of insulin. So please remember, the results of untreated diabetes due to a lack of insulin can lead to a stroke, prolonged heart disease, blindness, and even death. None of our people should have to worry about whether or not they could afford to survive. Now, this is exactly why myself and over a dozen co-sponsors have introduced this bill, because regardless of where you reside, these outrageous costs hurt the people in our communities. It is also why the Rhode Island Nurses Association, the Rhode Island American College of Physicians, and the Rhode Island Medical Society are in support of this bill and the two other insulin bills which are being heard tonight. So as I close, I want to highlight that there are several constituents in the district that I represent who have told me how this $25 limit on out-of-pocket expenses for insulin would transform their lives. And I am positive that these constituents exist in every other respective district as well. So now more than ever, we need to address the expensive cost of insulin and ensure that all of our people can afford the medicine that they need to survive. Thank you.
Thank you, Representative Morales. Does the committee have any questions for Representative Morales? Thank you. We appreciate your testimony. And I believe we have Representative Diaz joining us virtually. Representative Diaz, would you like to introduce your bill, please? I need you to unmute yourself. I'm sorry, Representative Diaz, I can't hear you right now. You need to unmute your computer. Okay. Representative Diaz, stand by for a moment.
Is now?
Representative Diaz, we can hear you. You're just going to need to turn down your volume on whatever other device you may have.
It's only one. It has some issues.
Okay.
I will try later.
Okay. Representative Diaz, what I'm going to do is I'm going to move on to the testimony, and once we get your situation figured out, we can go ahead and have you testify, okay?
Thank you.
Oh, okay, actually, we've solved the problem. Thank you to our tech people. You're ready to go. Go ahead and introduce your bill, please.
Chairman, can you please apologize me? I just get home and I opened this and I don't have the bill number in front of me. It's a House bill.
5251.
Thank you so much. And my apologies also because I don't understand why we introducing again. I just joined this committee, and because I saw the bill, I decided to join the committee as I should. But anyway, I'm very familiar with this bill. I introduced for the third year now. As many of you know, I was a volunteer for the Department of Health to educate individuals who facing the terrible illness of diabetes. As Rep Morales explained and went through a lot of facts about diabetes, I don't have to go again over the same information. I just want to say that my bill came from the needs of constituents in my district and around the state, that insulin is one of the vital medications to use it and to keep in control diabetes. So with that in mind, I introduced the bill 3 years ago, and I continue to do that in order to help the patients who are facing this terrible illness. So I'm very happy that 3 colleges, including Rep Kennedy, are working diligent with this issue in order to help the residents in Rhode Island who face this difficult time between choosing paid medication and pay others' needs that they may face. So House Bill 5251 is one more of the bills to addressing the need of making insulin affordable for people. So, Chairman and members of the committee, I appreciate this opportunity. Thank you.
Thank you, Representative Diaz. Are there any questions from the committee at this time for Representative Diaz? If not, we'll move on to our virtual testimony. Hello?
Hello,
Yes, hello. Who am I speaking with?
this is Julius Ferraro.
Hello, Julius. This is Representative Casey from the House Health and Human Services Committee. I have
Great.
you online with the committee at this time. If you would please keep your commentary brief and to the subject matter, we would appreciate it. You have the floor.
Hi, thank you. My name is Julius Ferraro. I am calling in to testify as a citizen of Providence, Rhode Island, in support of House Bill 5151. I think we all know insulin is expensive. It's so expensive that people die without getting access to this medication, and others make tremendous sacrifices. But while insulin prices continue to rise, there's been no change in the process for creating the product. Eli Lilly's insulin injections, for instance, cost American consumers $275 for a 30-day supply, and those same injections cost Canadian consumers only $32 a vial. The vial, which costs Eli Lilly less than $10 to make, those are exploitative margins. I think I said last time, those are drug dealer margins. Drug companies have been gouging patients for far too long, and they have to stop it. They have to make sure that everyone can afford their insulin. That is why a $25 cap is so important. By limiting copays to just $25 for a 30-day supply, we can make sure that people have access to these vital drugs. I ask the committee to vote in favor of this bill and vote in favor of the people of Rhode Island.
Thank you very much.
Thank you.
Are there any questions from the committee? Okay, thank you for your testimony, sir.
Thank you.
And we will have our next...
Mr. Chairman, this is June Speakman. Sorry to interrupt. Rep Donovan just texted me. She does not have the link to the meeting. So
Okay,
if
we'll
someone
get that
could
to
send
her.
that. Thank you
Thank
very
you.
much, Chairman.
Thank you.
Okay, we have our next virtual testimony. Good evening.
Hello,
Yes, hello. Who am I speaking to?
Alicia Rojas.
Alicia Ross. How are you, sir? This is Representative Casey, Chairman of the House Health and Human Services Committee. I have you here with our committee right now testifying virtually on the insulin copay costs. If you would keep your testimony brief and to the subject matter, I'll give you about 2 minutes if you can do it in that amount of time. You have the floor.
All right, thank you. Good evening, members of the House Committee on Health and Human Services. My name is Alicia Rojas. I'm 55 years old, a father, a husband, a proud union member of Laborers International Union of North America, LAUNA, Local 226. I have lived with diabetes for 20 years since I was diagnosed with the disease in 2001, and I have learned to live with the disease. I don't remember how much I paid for insulin back in 2001, Also, I do know that the cost, it has steadily gone up every few years. Now in 2021, I pay $100 a month for insulin alone. It is important to mention that this isn't a choice. I don't have a choice whether I want to take insulin or not. I do it because I need it to survive. I take insulin 2 times a day in order to keep my blood sugar low. Without it, my blood sugar levels would skyrocket, and the consequences would be dire. Do you know what happens to a diabetic who is unable to keep the blood sugar under control, or who does not produce enough insulin? My doctor has walked me through the various scenarios more than I could count. As a diabetic, I am at risk of losing my eyesight, developing heart disease, and kidney disease, among other things. Do any of you live with diabetes? Have any of you ever feared what could happen if you somehow couldn't afford your monthly prescriptions medications like insulin? These are not rhetorical questions. Somehow, you are all here debating whether the cost of insulin should go down or not. If the answer couldn't be any more simple. The cost of prescription medication should not be a partisan issue. The cost of prescription medication should not be dictated by pharmaceutical companies or even private health insurances for that matter. Your constituents living with diabetes are Democrats, Republicans, and Independents. As representatives, you were elected by the people to advocate in our best interest. It is not surprising that there is plenty of opposition to this bill, but is any of this opposition coming from people living with diabetes? This is the Committee on Health and Human Services, not the Committee on Corporations. The cost to produce insulin is less than $10, but insulin prices continue to rise. So how and why would you justify the high cost of insulin? I work hard every day to make sure I have enough income to support myself and my family, including my youngest daughter, Melanie, who is a young adult, 20 years old, with special needs. Melanie was born in October 2000 with spinal bifida and intellectual disability, and I was diagnosed with diabetes a few months after her birth. When I was diagnosed with this disease, I immediately thought of my daughter and what would become of her if I were not able to live long enough to advocate for her. And sure, she has a good life. When I learned I had diabetes, I worried and I would deteriorate like so many said I would. After 20 years, insulin is the thing that continues to sustain me and allow me to continue being around for my daughter. I am unfortunate to be able to afford my prescriptions every month, but it continues to be a financial burden, and many other people have to make difficult financial decisions like deciding between purchasing insulin or paying the rent. You have an opportunity here to make these things more just. You have an opportunity to cap the prices of insulin to $25 a month. I implore you to do this for diabetics like myself and the countless others who live in your districts. My quality of life and the quality of life of thousands of Rhode Islanders rest in your hands. Thank you very much.
Thank you for your testimony, sir. We appreciate that very much. Are there any questions for our witness? Okay. All right, sir. Thank you for your testimony. We appreciate you taking part in the committee meeting with us. We're going to call our next witness.
Yep. Have a good night.
Thank you. While we have this break, I see Representative Donovan has joined us. Representative, Second Vice Chair, I'm sorry. Would you like to be recorded in the affirmative with your attendance as well as the vote on the first bill for consideration?
Yes, please, Chairman.
So it will be done. Thank you. And we have our next witness online with us now. Okay. Who are we speaking to?
Hello. So my first name is Evan, last name McManamy. I am a social work student in the master's program at RIC, and I've recently done a study on co-payment restriction legislation in a variety of different states, and I'm testifying that I really approve of this measure.
Okay.
Yeah, it's passed successfully in Maine, New Mexico, New York, Utah, Washington, West Virginia, Colorado, Illinois, and I think it really deserves to be here in Rhode Island as well.
All right. Thank you very much. You have a little more time. Do you have anything else to add?
No, that's the main gist of it. Just that
Thank you,
full
sir,
support of this legislation.
thank you, sir, for being brief and succinct. We truly
Thank you
appreciate
so much.
that. Are there any questions for our witness? Okay, thank you very much. We're going to move on to our next witness. Hello?
Hello?
Yes, good evening. Who am I speaking to?
Kimberly DeCoupe.
Hello, Kimberly. This is Representative Casey from the Health and Human Services Committee. I have you online with us now testifying on the insulin copay bills. We have 3 bills that are in play right now for legislation. If you would keep your comments brief and to the point, we would truly appreciate it. You have the floor.
Yeah, I just was calling in support for the bill. I think it's just very important for us to limit the expenses of these prescription drugs. They've been way too expensive for way too long. And especially when you think about insulin, I think we need to cap that. And yeah, I think it should be something easy for us to do. It shouldn't be that difficult, really. What we really need is a single-payer healthcare system, and a lot of these drugs to be under a full, widespread cap. But I mean, I think, yeah, you guys need to support this and pass this, especially right now.
All right, thank you very much. Are there any questions from the committee?
No, thank you.
Thank you for your testimony, and we're going to move on to our next witness. Good evening. Who am I speaking to?
Hi, my name is Jacqueline Goldman.
Well, hello, Jacqueline. Nice to have you back. We heard from you a week and a half ago.
Yes.
Yes, this is Representative Casey from House Health and Human Services. We are testifying again on the copay, the bills for regarding limiting copays for insulin. If you could keep your commentary brief and to the subject matter, that would be much appreciated. Go ahead.
Absolutely. Thank you so much. So my name is Jacqueline Goldman, and I am an epidemiologist at Brown University School of Public Health, which as I said, as Chairman Casey said, I've been here before to talk to all of you. We've heard this fact over and over that, about 10% of the state's adults are diabetic, and that insulin prices do result in fatalities every year and people choosing between whether they can afford food, housing, or their medicine. And we have a number of bills in front of us to be able to address some of these, extremely high prices. And I think that, and I'm excited to see what happens with the sort of bill reconciliation process. But I would like to say that the $25 difference between the price caps is really important, and that as the representatives are writing their bills, that they really try to stick to this lower cap. I would also like to point out that I think that Representative Kennedy's point of making sure that there isn't a minimum deductible is also very important. I really am in support of 5151 because I think that $25 difference in cap is extremely vital, but do see merits to the other bills proposed, and I'm excited to see what this committee can do in terms of putting together some legislation that will result in lives saved in the state. And that's really all I have to say.
Thank you very much. Do we have any questions for the witness? Thank you, Jacqueline. We appreciate your testimony.
Thank you.
We're going to move on to our next witness. I'm sorry? Okay. Do we have, you have a Terry Martesian? $5196. Okay. 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 Yes, yes. Okay. All right, so I believe we have, that's all we have for virtual testimony on this bill. This is actually also a rehearing, so we did keep all of the testimony, written and virtual, from our hearing 2 weeks ago. So what I will do is move on to our next bill,